Dr. Paul Farmer is possibly the most prevalent humanitarian of the modern era. Dr. Paul Farmer lived the Paschal Mystery using his medical and academic gifts in various third world countries across the globe. Farmer comes from humble beginnings. Born in 1959 in Massachusetts, Farmer grew up with 5 siblings while cycling various mobile homes. Farmer had an idea of charity instilled in him even when he was quite young, as his father was involved in elderly care and care for people with intellectual disabilities. It wasn't until Farmer would go to Duke University on scholarship and eventually graduate from Harvard with an MD and a PhD that he would be given the opportunity to use his medical gifts to the poorest of society. Dr. Paul Farmer took a strong liking to medical anthropology, or the study of how culture and politics affect health. During his stint at Harvard, Farmer would routinely go to Haiti and medically surveil the people with 6 other Haitian medical inspectors. Until one year, he returned to Haiti and 3 of his Haitian friends had died of cerebral malaria, and the only treatment they had received was voodoo treatment, as was the culture in Haiti. After recovering from his grief, Farmer knew that helping the people of Haiti was his calling. After graduating, Farmer was able to travel to Haiti as a volunteer and work as a medical director at a charity hospital for the dispossessed farmers of Haiti. Farmer was struck with a profound love for caring for the poor. Farmer would go on to say, quote, "There is nothing I like more than building a hospital. That's what I call a good pastime, and that inspires me," end quote. Paul's love for helping the poor gave birth to perhaps his most famous credential: founding the Partners in Health organization. The Partners in Health organization has established clinics for the poor in countries like Rwanda, Haiti, and Lesotho, all the way to countries like Russia, Mexico, and the Navajo Nation in the United States. Farmer and his partners would establish the organization with the idea that people should not die or suffer from a readily treatable disease simply because they are poor. Farmer and his organization would spend their first decade of inception working to stop small viral outbreaks in Rwanda and West African countries until they would tackle their first epidemic, multi-drug resistant tuberculosis. Farmer would find himself tackling the tuberculosis epidemic when his longtime friend would travel to Peru to aid the people in a squatter settlement outside of Lima. He would contract multi-drug resistant tuberculosis, and after returning to Boston to seek the aid of Farmer and his organization, he would succumb to the disease. After this experience, Farmer and the Partners in Health would travel to Peru to fight the viral outbreak. With the help of his new organization, Farmer would help aid the people of Peru and eventually the overflowing prison systems in Siberia with the tuberculosis outbreaks. Farmer and the Partners in Health were so effective that before his aid, 25% of tuberculosis cases in Siberian prisons resulted in death. And 1 year after his arrival, it was down to 0. Paul Farmer would further use his knowledge in infectious diseases to tackle the Ebola outbreaks in Liberia and Sierra Leone, and was a leading figure in the stopping of the Zika virus outbreaks. A large part of Farmer's dedication to the poor came from his religion. Being a Catholic, Farmer grew up in a family that wasn't religious, but Farmer would become deeply religious following his meeting with a nun named Sister Juliana de Wolf, who would show him the importance of serving the poor. Sister Juliana worked with the United Farm Workers chapter. He witnessed them aid the migrant farm workers who rarely had anyone that would help them or give them the aid that they needed. Sister Juliana would teach Farmer the doctrine of, quote, showing up. Farmer would even go as far as to say, quote, what they were willing to do for other people changed my life, end quote. Farmer would say that religion didn't mean anything to him until he was a young adult and met people like Sister Juliana, who were, quote, living out the gospel. Farmer continued to aid the people of Africa and other poor communities without the luxury of medical aid throughout the world. He would continue these works for close to 40 years, innovating new revolutionary techniques and community-based treatment strategies that could deliver efficient medical care in exceptionally underdeveloped regions of the world. Wherever the poor needed aid, that is where Dr. Paul Farmer was, embodying the Paschal idea of service for the poor rather than yourself. Dr. Farmer would eventually succumb to cardiac arrest while sleeping in 2022, but his impact will far outlive him and likely all of us, as his organization, Partners in Health, is a leading charity organization that helps thousands across the globe. Paul Farmer's story teaches us that service to the poor can bring a profound change to not just the people around us, but the entire world. Dr. Paul Farmer pioneered the ways of charity, and whether you pursue a medical profession or you simply want to do a little bit for your community but you don't know how to help, just do what Dr. Paul Farmer did and look to the poorest and most vulnerable, and that is where you can help the most.